scale of 1 to 10, 10 being the highest, being the most painful, I always tell my patients, iba-ibang experience yan eh, di ba? Kung si patient may anxiety, di ba? Of course, dapat mini-measure mo yan eh. Sa umpisa pa lang, when you talk to the patients, you ask them regarding how fearful they are, di ba? And then you try to tell them na implants are safe. Implants are not painful actually. I've had patients na sinasabi parang, tapos na pala, di ba? Hindi nila nararamdaman yun eh. Ay, gano'n lang pala kabilis. That's the usual reaction patients are getting. I'm getting from my patients na mas kinakatakutan nila yung makita nila yung binubutas yung buto kasi because of social media, di ba? Nakikita nila na, uy, madugo. That's one of their first impressions. Madugo. Tapos parang hihiwain yung gums. It's the fear na nakikita nila yung ganoong process. But when you talk to them during assessment, that's the first thing. You tell them, I can tell you, it's not that painful. Mas masakit pa po ang ang bunot. Mas masakit pa ang root canal. Pwede when hot tooth yung ano, 'di ba? Yun yung lagi kong sinasabi sa mga pasyente ko. Advantages, you always have to tell the patients that there is no such thing as a 100% guarantee, diba? For a successful implant. You always tell them there are, they should be ready, diba? Sometimes when problems occur, the earlier the better, diba? Sasabihin nila sa'yo. That's why recall is always essential. When you do an implant, you always ask and recall the patient. You always have to see them like post-op. Hindi mo pwedeng iwan yan. Kasi sometimes if the patient neglects the implant, it ends up na hindi successful, di ba? It can work both ways. Basta, the important thing for us dentists, we should always be ready. The treatment should always be acceptable. We always have to be ready with good diagnostics, with good CBCTs. Ready dapat yung gamit, dun pumapasok si Dio. They always have like good quality implants. Nandyan yung sizes. Yan yung isa sa mga pinaka-importante pag naglalagay ng implant, di ba? And with the help of Master Leo, kahit anong oras, di ba, pwede mong tatanungin or i-message mo lang siya. Si Dr. Jel nga, kahit nasa New York, call a friend pa rin, kaya pa rin natin i-message. Kahit nahihiya na tayo, pero sumasagot pa rin pala siya. So, kahit sa ganong paraan, it's a teamwork together with a good supplier, you end up with a good result. If you take good care of your implants, they can last forever. As long as you go to a dentist, and this is one of the good things that you can promise to your patient, na pag nagpa-implant sila, 'di ba? Ang success rate can be at least 90%, 'di ba? Lagi natin sinasabi, it's not 100% guarantee, but 90 is a big number. Oo naman, it's a better option. You go to your dentist, you have yourself assessed. If you still have good bone dahil long denture wearer ka na, di ba? Usually if it's 10 or more years, medyo numinipis na rin kasi ang buto natin because of matagal na nga nagde-denture po. So i-assess po yan ng dentista or ng makikita rin po siya sa CBCT, which is one of the most important diagnostic tools for making a good implant. Is makita is if you still have good bone. If kunyari your dentist doesn't see ideal bone, then may mga other recommendations po na gagawin ng dentist, such as bone graft or magdadagdag po sila ng buto, which can lead to implant placement rin po. Reject ng bibig ng pasyente, meaning hindi naging successful yung implant. Practice ko po, meron kaming cases na ganon, maayos naman naming plinano, we gave it some time, but one of the problems that we encountered was poor oral hygiene si patient. So, nung talagang medyo hindi na maganda yung hygiene niya, kahit sa recall namin, linis kami ng linis, pero nung time na nakita namin siya ulit, it ended up na ang decision namin was to remove the implants again because it already caused peri-implantitis, which is the #1 kalaban ni implant. So you always have to tell the patient na talagang good oral hygiene, avoid, ako personally, I don't push like implants pag nakikita ko na heavy smoker talaga yung yung patient. I try to tell them if they can cut some of the smoking. Kasi one of my patients also who was a very heavy smoker, nag-end up na tinanggal ko rin yung implants. Contraindications, di ba, for when we try to assess the patients if we ask the patients if they are heavy smokers. So sabi nga, I remember Master Leo before when we were learning the one of the implant seminars, sabi niya, you can try to ask the patient if how many sticks a day, how many packs a day, parang ganon. Lalo na pag sa anterior yung implants, pag naninigarilyo, yan yung unang tumatama, di ba? So it might cause problems in the future dun sa pagtanim mo ng implants. So nagkakaroon ng, kumbaga, poor healing, bone loss. Yun yung mga factors na you have to plan ahead. Dapat lagi mong iisipin na ano kayang pwedeng maging problema in the future pag nag-implant si patient. You just don't think of the present situation of putting an implant. You always have to think of the after care of the patient. That's why you always have to remind them, give them post-op instructions. Kung pwede, mga reminders pag nakikita mo siya sa kanila, yung recall, yan ang pinaka-importante. Hindi mo pwedeng one time lang na nagpa-implant, hindi na babalik sa clinic mo. In my practice, I've had patients who have diabetes, as long as may clearance kami ng doctor niya. I have you also have to request for labs ng mga patient. So pinapadala rin namin sila for CBCs, and then ipapacheck rin namin blood sugar nila. Siguro it can take about 2 weeks for clearance. You ask your patients to get clearance just to be on the safe side, diba? And if controlled naman po yung diabetes and you have kumbaga go signal sa doctor nyo, then pwede rin tayong mag-implant. May mga patients rin naman na may diabetes na nagpapa-implant.